Welcome to the CereCore podcast, where we focus on the intersection of healthcare and IT. From practical conversations to strategic thought leadership, let's unpack the decisions, challenges, and journey of those whose purpose it is to deliver technology that improves healthcare in their communities. Well, Cory Lane has been serving as the IT manager at OakLeaf Surgical Hospital in Altoona, Wisconsin, and is transitioning into her new role as Director of Operations at OakLeaf. She began her career in clinical informatics and has used MEDITECH for almost a decade. Welcome to the podcast, Cory.
Thank you. I'm glad to be here.
So we always love to start these off with just a little bit of sharing. So if you wouldn't mind, tell our listening audience kind of a little bit about yourself and your journey in healthcare IT, and maybe just touch on a little bit about OakLeaf and Surgery Partners and your roles there.
Sure, absolutely. Thank you. I appreciate the opportunity to speak with you. I am actually originally from southern Wisconsin and went to college up here in Eau Claire, Wisconsin. Came out of college and had a degree in speech pathology, of all things, and ended up getting a job as the receptionist at OakLeaf Surgical Hospital. And I've never left. I have enjoyed every single role I have had here. This hospital and organization is a physician-owned hospital and takes amazing care of both patients and employees. And I am honored to be a part of now the executive team as I start my new role. So I was a part of, very briefly, our original EMR implementation in 2011, just from a business office perspective, and then transitioned in, like you said, Phil, into informatics, and was the informatics manager and IT manager since 2015 here. So we had MEDITECH 6X, and then we just transitioned to Expanse.
That is a fantastic advertisement for why people should come work at OakLeaf.
Yes, so, it's a great place.
That's excellent. So, OakLeaf specializes, right, in outpatient surgery, and certainly when it comes to patient care, operational efficiencies, absolutely critical. And so, maybe if you wouldn't mind, walk us through some of those operational must-haves that an organization like yours, just needs when it comes to technology and when it comes to that EHR that we talked a little bit about.
Yeah, absolutely. It's critical. We found that we maxed out on our prior system and that we needed more from it. We needed to be able to provide our physicians with more information in their documentation. We had a very hybrid system. We were some electronic and some paper-based, and that in and of itself causes some inefficiencies. And so we're scanning things in and then promptly printing them back out for healthcare. And we wanted to make sure that we could sustain for the future and maybe save some paper along the way. So that was a huge importance for us is providing documentation and just flow of that clinical information as the patient comes from the start of the stay all the way through discharge and beyond, and that the physicians and nurses alike had access to that information in an efficient way.
That makes great sense. So you touched a little bit on it. You've recently gone through a project completing a MEDITECH Expanse implementation and had the privilege of talking with Ann Hargrave Thomas, your CEO there, on a previous podcast. And, she talked a little bit about the collaboration between OakLeaf and Surgery Partners, and CereCore. And we worked together really from that assessment phase through the go live. And so, from your perspective, maybe from that little different perspective than Ann had, what was top of mind with such a big technology change for you?
All three parties were very, very much needed. So everyone had their role. And, we here at the local level and on site had the vision, right? We knew what we wanted. We knew what our shortfalls were. We knew what we wanted to improve on. our CereCore partners all came in with great knowledge. We ended up having 3 project managers, CereCore one, a Surgery Partners one, and then myself. And in the beginning, you're all trying to figure out your way and who fits where, but ultimately, they were all needed because every single aspect of it had the right attention. And from an IT perspective, Surgery Partners definitely brings their A game when it comes to that, and their resources that they have on our IT side were instrumental in just the amount of access we had with them and we had with our CereCore partners, both on the technical side and on the professional services side, was ultimately why we were successful.
So, it's, I think what you stated can't be overlooked. And that's so many times people go, oh, well, we have a project manager.
Yes. Yep.
And I think sometimes folks lose or don't have the quite understanding of how complex these projects really are. How many people are touched, how many folks are influenced and have say and really organizations do themselves a bit of a disservice when they don't resource them properly, not only from the folk, the hands on the keyboards, but also, as you stated, in that project management arena, because, herding all of the proverbial cats is a tough thing to do.
It's a lot, especially when you throw in third-party vendors and all the testing and everything that goes along with that. It is definitely everyone was very, very attentive and had their role and herded their cats and and it worked out really well. It worked out really well. There were some things we didn't notice, at the beginning and ended up having to shift resources and add resources, but everyone was on it. And that's what ultimately was important.
Oh, no, that's great. So you're now live and it's been how long now?
Oh gosh. I think we signed our contract with Expanse at the very end of 2021.
Okay. Yep.
So, and for us, it was certainly, we were very close to signing when COVID hit. So this is a long time coming for us.
Yes. Well, I know it feels good to get live, but as we all know, going live is just the beginning of the next journey.
Yep, absolutely.
For an organization. So, and maybe we'll talk a little bit about that. I think in the context of journeys and, you start with implementations and then ongoing journeys and, the term, I think partnership, right, gets thrown around a lot. And as part of this process, there was a group of partners. We've mentioned OakLeaf, we've mentioned Surgery Partners. You graciously mentioned CereCore, and MEDITECH. You can't forget the vendor as well, and that from a software perspective. So maybe talk a little bit about kind of the value of that, not only in the context of the implementation, but then also from an ongoing standpoint.
Yeah, absolutely. As I stated before, just from the implementation side of it, it was everybody brought a different angle. But I think, some once the implementation, then some people move on to other projects. And I do know that, Surgery Partners and us here on site, we still have a lot of work to do. We don't want to take our foot off the gas because we had an amazingly successful implementation, but we all know every plan, right, needs a relook and things we thought would work wonderfully maybe don't. And so I think we're committed now, along with Surgery Partners, to just optimize and with MEDITECH as well, and make sure that we are, everything is just doing what we intended and thought it would do. And when it isn't, we certainly don't want to ignore that. So our patient safety is of utmost in concern, and we look at everything under that lens. So as we're reviewing workflows and our nurses are totally engaged, and everyone from our clinical staff right up through our CEO and have been completely engaged. And that's what made us successful.
That top to bottom engagement is so critical. For an organization, because when everyone's bought in and they truly understand the why and they understand the importance, it's just honestly it's amazing what transformation can occur.
Yes.
In the spirit under which that it happens. And so that's so neat to see. And so, I'm sure you've had opportunity now post go live to kind of hear some feedback, right?
Yes.
From the user community, from the clinical staff. Obviously that flows into some of that optimization work you talked about, but
absolutely.
Are there any kind of those early results or maybe those things, comments from clinical staff or women goes, oh my goodness, now we have X, and oh, by the way, now my juices are flowing.
Right, now we can
what about this, right?
Yes. Yep, absolutely. I think our staff and the different subject matter leaders of the different modules spent so much time in training, in testing and simulating, and so much time. And that's what paid off in the end. So that on go live day, we were running around, don't get me wrong. I don't want to paint a picture that wasn't real, but it really went very smoothly. And I chalk it up to all the hard work that everyone put in up front and in the training. Now that we're post live and, going through that, we have a documentation committee that our clinical staff are very involved in with our informatics team. And this is where we bring, changes that maybe pre-op is bringing to us potentially could affect what happens on our med-surg floor. And so we try to be very thoughtful about those discussions and decisions and make sure that we look at those downstream effects so we make the right choices. And that's all in our optimization phase. And it's exciting. If people are, like you said, their juices are flowing. It's like, oh, this is great. And we've got so many trackers and things we weren't able to do before throughout the hospital that are just, helping our clinicians.
I think a lot of times people get that kind of project/go live fatigue.
Yes.
And so you mentioned, but yet, you've got this process now in place where you're gathering that feedback and that documentation, that cross collaboration. Do you have any sort of insights for folks as far as, hey, maybe how that should be set up, what the cadence of that should look like? Because I do think that sometimes people just have a tendency to, okay, there's that letdown, and then they maybe miss the next meeting, and then life catches up and so on and so forth, right? And then all of a sudden you that trajectory that you were on, starts to plateau a little bit. So maybe some guidance for our audience as far as, how you've helped avoid that and put together some of the incentives to keep that momentum moving.
Yeah, I think it's about empowering the people, the end users, to speak up and let them know that we don't take it personally, right? Just because I built it doesn't mean that I'm offended when it doesn't work. And, just try to create sort of a welcoming environment to share frustrations and concerns. And just also being open and honest that this is all a part of this. This is what we expected. This isn't surprising that this or that maybe didn't work the way we thought. And we knew that was going to happen. And we want people to feel comfortable to come and share their ideas with their peers and troubleshoot together. And we've found great value in that. And, not realizing the impact of something someone in pre-op is doing and how someone later down the flow of the patient actually uses that information, which makes all of us understand the why behind what we're doing, and ultimately the quality and the diligence kicks in once you understand that. So I think it's just really important to work with the end users, give them that voice and the forum in which to share, and then come up with solutions as well.
One of the things you touched on, and it sounds like just from leadership through your teams, is it just has the utmost respect for each other. And I think that that plays in a large part as well, because then all of a sudden folks feel that freedom to have the conversation, and they don't take things personally when, oh, yep, I had made that decision.
Right,
But
I
you're
spent
right.
2 hours
I
on
missed
that.
this point. Yep, exactly. And it's so easy to do, but
Yeah,
in the context of things, you're like, hey, listen, yeah, this is new for everybody, and we're doing, we're all in it together. And so no, that's certainly
and when you
wonderful
have
to
that
hear.
team, I think people are more apt to get creative and think outside the box. And, like, okay, maybe that actually means we have to change an entire workflow, but maybe that's better. And,
Yeah.
we really got to a point where their brains were so open and just critically thinking. It was such an amazing thing to see. And just the pride when you see that happen and the teams are all doing that. And it's like, wow, this is amazing. You guys have really, see the value of doing this in a way that actually is thoughtful and makes it useful for you.
Well, and I would think that there are, you see the value not only in the workflows as it pertains to the clinicians, but
Yeah.
have you begun seeing how the investments in technology have that same direct impact on the care that you're delivering to the patients?
Well, I think we're saving trees, so there's that.
That's
Positive
important.
environmental. No.
That's right.
Yeah, no. I think we are seeing how information can flow, and
Mhm.
and now I'm excited to take the next step and dig into we have a module called business and clinical analytics where we can
Yes.
really dig in, and I'm hoping from a clinical side to be able to pull out useful data for our clinicians and nurse managers to be able to look at real life information on patients and pain levels, and be able to make important decisions off of that. And then just also, we brought our anesthesia group electronic from paper, and having that information in an electronic way has also been very helpful. So there are many things um, that are impactful throughout the hospital, and so much more to come. This is just the beginning.
I think you hit the nail on the head. It's
Yeah.
just the beginning, right? You have to get that foundation of a
Yep.
modern EMR in
Yes.
place so
Yep.
that those workflows are there, the data's there. Then you can leverage that data in the right place
Yeah.
at the right time in the
Yep.
right hands without having them to go, well, wait a minute, I need a report, and can someone go build that for me, and can we do
Exactly.
this? No,
And
they
2 months
have
later, you might have your information.
exactly versus
Yeah.
when you actually need it in
Right.
order to make the
Mhm.
decisions that are needed for that patient.
Yes,
So that's
absolutely.
fantastic.
Yeah.
That's fantastic. So, we've talked an awful lot about, the projects being
Yeah.
large from an
Mhm.
EHR perspective,
Oh, yes.
teams getting overwhelmed, and how you've been able to deal with that, at OakLeaf, which I think is fantastic. So, we always love to wrap these up with just kind of some last words of wisdom, right?
Sure. Mhm.
And I'll ask the question, Cory, maybe in two parts, right? One in the
Yep.
context of an EHR implementation or a major project upgrade, but
Yep.
then just in general from an
Sure.
IT perspective, and that is, you know, what are those things that if you're going through a project, what are those top things, and maybe just summarize because you've made some wonderful points there. But then going forward, you touched on so much about the organizational
Mhm. Yeah.
components and
Yep.
how IT works with the rest. And so if you might maybe touch on some of those, because I
Sure.
know those are near and dear to our listeners' hearts.
Yeah. Yeah. I think um, my best word of advice for anyone is to advocate for yourselves, because we came in with the vision. Like I said, the hospital here knew exactly what we wanted, and that wasn't always easy to achieve, and I don't like to take no for an answer. So, okay, no, that way, then how can I accomplish this a different way? And that's a lot of work, and it takes a lot of energy, but in the end you get a product in which works for your type of practice and your clinicians and ultimately your patients. So we, we didn't like to give up on the details because those are what are important to us. And so as we went through this project, there were times when we, said, no, we're going to have to figure this out, or we're going to have to creatively think of a different way to handle this because this is important to us. And we ultimately always come to the right answer using, our partners like we talked about earlier as our advocates as well, and working with MEDITECH. The other piece that I would talk about is just from an IT and a project perspective, but also just IT in general in a clinical setting, is user experience. It's paying attention to when a clinician walks up to a computer, how easy is it for them to log in? What happens when they badge in? How can we set that up so that it's ease of access, so that it's they're focusing on their patients and they're not having to, try and get the computer. And that's something that I took very personally in this process and worked very closely with surgery partners. And I think we still have some work to do, but we have not let that slide. And working with our IT partners at Surgery Partners and CereCore just to make sure that we've brought in all of this. Let's make sure that it actually works and that it's not cumbersome. So that'll be a focus too as we move forward.
It's fantastic. It's the proverbial, walk a mile in someone else's shoes.
Yep, exactly.
And, it's, I think, what the industry loves to call it rounding.
Mm-hmm.
Okay, well, sure, I guess you can use that term, but I'm sure we can probably come up with a better one at some point. It's a little bit more personal.
Mm-hmm. Yeah.
So
yeah, I mean, it's definitely worth attention, and I think it's impactful to those clinicians, and anything that we can do to make their lives easier will ultimately reflect down on their patient care. So
absolutely.
Yeah.
Well, wonderful. Well, Cory, thank you so much for being with us today and for sharing your insight and wisdom to our audience, and certainly for the partnership that we've been able to build with you and with the rest of the team there at OakLeaf.
Yes, thank you. I really appreciate the opportunity to speak with you.
Excellent.
Thank you.
Wonderful. Thanks for listening to the CereCore podcast. We hope you enjoyed this conversation. Follow us on your favorite podcast platform for more episodes. Connect with us on LinkedIn. Visit our U.S. website at CereCore.net. And for those abroad, visit CereCoreInternational.net. Learn more about our services and find resources. At CereCore, we are healthcare operators at heart and know the difference that the right IT partner can make in delivering quality patient care 24/7. Let's help make IT better. Here's to the journey.